chest X-ray is a common investigations in hospitals. This is usually the commonest used X-ray is the chest X-ray, usually taken from the posterior part of the body to the anterior. The patient facing the wall and the X-ray pass from the posterior part of the body to the anterior. Usually the patient is supposed to take a deep breath so that there is good exposure of the organs. Normally, the X-ray shows many different things. From the outside of the body, you'll see the soft tissue where we have the skin, we have the muscles, and it can show either presence of lesions in the skin or the muscles, presence of air. Then from the muscles, you go to the bones. So you are looking at from the clavicle, you go to the ribs, and then from the ribs, you go to the diaphragm. Then from there, you look at the lungs. An X-ray will show you the lungs from the upper part going up to the lower part, and then from the lungs, you see the heart. The heart is usually not as penetrated as air, so it looks white in an X-ray. Then it will show you the characteristics of the heart, whether it's enlarged, and the different parts of the heart. Then from the heart, you look at the middle part of the chest, and there you will see the trachea and the bronchi, and also you will see the mediastinum, which is the central part of the chest, and any lesion that is there will be seen. So you can see different parts from the middle part of the chest. You have the heart, you have the mediastinum, and then you have the lungs. And it is used commonly to diagnose conditions like enlargement of the heart, presence of lesions in the mediastinum, and also the presence of fluid in the lungs, which we call a pleural effusion, and also consolidation like in conditions like pneumonia. It can also help you to see abnormal growth in the lungs. So in summary, a chest X-ray is a common investigation in the healthcare, usually taken from the posterior part of the body to the anterior, but in very sick patients, sometimes you can do an anterior to posterior, but this one is not very good in assessing the heart. And you can also do a lateral view, which is taken from the sides, and it usually used to diagnose pathologies in the lungs, the heart, and the middle part of the chest. Thank you very much. These are some of the basics of looking at a basic X-ray.